Yeah, elderly patients, who are the majority of patients affected by chronic lymphocytic leukemia, are becoming a challenge somehow because now we have a number of therapies, chemo-free treatments that are very well tolerated, but every treatment has different adverse events, may lead to different tolerability of the drug. So we have really to assess our elderly patient in a more general fashion. So we can not only define the genetic features, which is important for every patient with CLL, to define the immunoglobulin gene status and P53 status, but in elderly patients in particular, we have really to have particular attention to the comorbidities. So if there is a cardiovascular history, if there is a renal insufficiency, and anything that can make it more likely that the patient will experience a certain adverse events on the drug that he or she will be taking. At the end of the day, all drugs are very well tolerated, much better than chemo-free. So for some reason, nowadays it's even more difficult to decide between the different therapies, and the patient preference, in particular the elderly, it's really becoming important. Also from logistical point of view. So really, if the patient wants and has the possibility to access frequently the hospital, for example, if he can come every month to get an infusion of antibodies, like it might be in certain fixed duration treatment, or he prefers to take a few pills every day, coming to the hospital only maybe once every 3 months. So also these logistical aspects will have a major impact in the decision of the treatment for our elderly patients.